think that there was any benefit in the group that reduced their intake of fat and cholesterol in terms of heart disease, strokes, cancer deaths? No. So there was no difference. So at the same time that this study was going on, there was another study that was launched which is called the Mr. Fit trial. So Mr. Fit trial took another 50,000 men, followed them for 8 years, cost a similar amount of money, and they wanted to reduce multiple risk factors. That's why it was called Mr. Fit. So they asked them to reduce the risks of smoking, reduce the intake of fat and cholesterol in their diet. So half of them were told, reduce your fat and cholesterol, quit smoking. The other half were told, just do what your doctor advises or what you want to do. You don't have to change your lifestyle. So at the end of 8 years, in 50,000 men, was there any reduction in the incidence of heart disease, strokes, or cancers? Because the nation is trying to prove, based on Ansel Keys' observation, that reducing fat content in your diet would reduce the risks of heart disease and strokes and cancer deaths. Was there any benefit?
Well, if they quit smoking, they're decent.
So you are right. When they looked at the subgroup of people who quit smoking, that's the only group that benefited. Whereas the group of people that reduced their intake of fat, there was no benefit. So the diet heart hypothesis has been tried in at least 10 or 15 trials between the span of 1950s and 1990s until people gave up. They said, we can't prove this. We can't prove that eating fat results in heart disease. So another theory was born. And what is that theory? The theory was that, we have not been able to show it that reducing your cholesterol levels with diet will benefit. So what we are going to do is we are going to reduce your cholesterol level with medications and show that the diet or the lipid hypothesis leading to heart disease is accurate. Okay? So how many of you buy into the notion that reducing cholesterol in blood with drugs will reduce the incidence or will reduce the chances of you getting heart disease, strokes? Show of hands. So there's one. I mean, you guys are a little timid because I would have expected the entire audience to raise their hands and say, all my doctors say it. Dr. Ali, you said it. I don't know what happened here. Dr. Ali, I should probably just not even use this. Said, Dr. Ali, you said it yourself that it's not working.
When the battery's down and things, they just go like that.
No, battery is good, sir.
Battery's good.
He says, you said it yourself for 25 years that taking cholesterol lowering drugs and reducing your cholesterol will reduce the risks of heart disease. So this is something new that I'm going to talk to you about. So I am on territory which is kind of a little bit foreign because I have not discussed this openly with you all. So I'm not giving you individual medical advice. When you take this advice, I want you to discuss it with your physician, and if I am your physician, discuss it with me. But anyway, there was a frenzy among people who were at the higher ups that wanted to prove that reducing cholesterol with medications would reduce the risks of heart disease. So the first trial that was started out was called the LRC trial, the Lipid Research Clinic trial. They investigated nearly about 50,000 people and took the people that had the highest amount of cholesterol. So they didn't take average risk people, they took people that had the highest amount of cholesterol. And at that time, the drug statin was not available, so they gave them a drug called Questran. Velcol is a newer version of that. So Colestipol or Questran. So half of them were given Questran, the other half were given placebo. These people were followed for 8 years. The average reduction in cholesterol was about 15% in the group that took Questran. What do you think happened?
We got the slides going a little bit.
Oh, wow.
You want to figure out. Sorry.
Oh, good.
Yeah.
Okay. Now that the slides are going, maybe we can go with the slides. Let me just let me just manipulate it from here. Can we get this out? What is that? Why is that showing up there? I can't manipulate it from here, huh? Okay. Oh, good. But I can't change it. Okay, Nina, stand here and change it for me. All right, I'm here, so I'll do a few things different. My mic is not working now. And those monitors are not on. Sorry, guys. Now the mic is working. Okay, good. So, what I want to tell you is that when we were hunter-gatherers, I'm going forward.
That's your first slide.
Yeah. I can't go back and forth. This is okay. So, when we started out, as in our ancestors, we ate a lot of animal food. That's what we ate. And we preferred the fattiest part of the animal. We would eat the marrow, the brain, the organs, and we'd leave the lean part of the animal for the scavengers. And our consumption of vegetable sources was nuts and fruits that was bitter and tart, not sweet like the fruit that we eat now. So we went through the diet heart hypothesis. We showed that Ansel Keys showed that the more fat you eat, the more heart disease you get. And then we went through the Women's Health Initiative study that showed that after studying, and I think I said 50,000 women, but it was actually 100,000 women, 93,000 to be precise. And then we went through the Mr. Fit trial that after 7 years showed really no benefit in terms of health. So in the town of Framingham, Massachusetts, started the Framingham study. It's a little town in Massachusetts. And they were following a cohort of patients for 30 years. So in this cohort of patients that they were being followed for 30 years, they were studying whether factors such as increased cholesterol or increased fat intake in your diet is related to heart disease. And this is from one of the study directors, Dr. Castelli. He said that the more saturated fat one ate, the more cholesterol one ate, the more calories one ate, the lower was the patient's serum cholesterol. And we found that people who ate the most cholesterol, most fat, and most calories weighed the least and were the most physically active. So this is something that you would think is completely contrary. Go ahead, Nina. So when we dive a little bit deeper into it, we find that Dr. Keys conveniently lied. So in order to fit his theory that fat causes heart disease, he used 7 of the 22 countries from which he got the data. So he got data from 22 countries that showed that it was basically a scatter plot. You could not say people eating more fat got heart disease, because there were people in Holland, people in France that ate the highest amount of fat and their incidence of heart disease were the lowest. So let's go next, Nina. So if you took these 7 countries, you would show that as fat consumption goes up, the incidence of heart disease comes down. And you can choose another 7 countries that shows an even more dramatic reduction in heart disease as fat consumption is going up. So what I want to tell you is that what you hear from big researchers may not necessarily be the truth. They may lie. So George Mann was one of the directors of the Framingham study, and he then went and studied several isolated populations that were not influenced by the modern diet. And this is what he had to say, that the diet heart idea is the greatest scientific scam of our times. So, when I talk about it like this, I feel a little uncertain because I don't want to put anybody else down. But I have looked at this area for the last 2.5 years, and I get more and more convinced that the truth should come out to you all. Let's go next, Nina. So this is a map of Europe, right? And in the map of Europe, you see red areas and you see white areas. So the red areas belong to France. The red areas belong to Sweden. So most of Western Europe, it looks like red. And the areas that are white are like Russia, the Russian republics, the Azerbaijans, and things like that. So the redder a country is, the more the intake of fat they have. That means they are eating more fat. So if you eat more fat, you should get a higher incidence of heart disease and strokes. If you eat less fat, you should get lower incidence of heart disease and strokes because you're studying large population of patients. So let's see what happened. So this is heart disease in the same group of people. And now the redder the region is, the more the incidence of heart disease. So you would expect the red to be in Western Europe, right? In France and Sweden. But you see red in areas where there was the lowest intake of fat. Now what about strokes? Okay, so strokes was the same. It followed the exact same pattern. The more the country ate in terms of fat, there was the lower risk of having strokes. Because if you've had a TIA or if you've had a stroke, the first thing that your doctor will do is to put you on a statin, a cholesterol lowering drug. And that, I think, I'd like to challenge and tell you is wrong if you come to me for individual advice. Let's go next. So we came up to here already. We said that they could not prove the diet heart hypothesis through many studies. So they said, well, we're going to go by showing that using a drug, cholesterol lowering drug, reducing the cholesterol will reduce the risks of heart disease. So the first trial was the LRC trial. Let's go next, Nina. So there were many studies that were done, but for the sake of time, I'm only going to focus on the LRC trial, which we already did. Next slide. And this was done, sponsored by the National Institute of Health. We spent a lot of money on it. 4,000 people with the highest cholesterol got into the trial. Go next. And at the end, what we found was that there was absolutely no benefit in terms of reducing death or heart attack in that study. It was hugely disappointing. So in 1994, so this presentation that I'm giving I have never given before. So bear with me and I want to see what your reaction is from this. In 1994, a trial was done which is called the 4S study. It was the Scandinavian simvastatin study. 4,444 patients were enrolled, and it was a mega impressive trial for the statin industry. It was positive compared to any other trial that was done before. So before I get into that, I want to talk to you about what is called the Vioxx affair. Do any of you know about the Vioxx affair? So you do, okay. So in Vioxx affair, Merck admitted to doing wrongdoing, which is the company that makes the drug that was used in the 4S trial. It's Merck. In the Vioxx trial, Merck admitted to wrongdoing and paid the government $5 billion. Go next slide. Oh. Okay. So our cohorts in Angleton, Texas, the widow of that sued the company for death of her husband who was taking Vioxx, who died of heart disease, and the jury in Angleton, Texas awarded this person $300 million. Go next. So the reason the Vioxx scandal started is that in the year 98, 99, when Vioxx was being applied for a patent, the company knew that Vioxx increased the risk of blood clot formation and perhaps increased the risks of heart disease. But the company withheld that information from the FDA. Then in 1999 to 2001, they did a trial called the Vigor trial, in which they tried to show the benefit of Vioxx over naproxen in patients with arthritis. They said Vioxx is so much better than naproxen in patients with arthritis. But what happened is that people who were on Vioxx were getting more heart attacks. But that was not what the company wanted to hear. So whenever a trial is done, there is a safety monitor, which is called data safety and monitoring person, who's supposed to be independent of that industry. So that person, the Merck people offered them a very lucrative consulting contract that started a few days after the trial ended. Okay? So when the trial was published, they calculated the heart attacks in that trial for a period of about 35 months, eliminating the last month so that they wouldn't have to show that it was increasing the incidence of heart attacks, whereas they calculated the benefit for 36 months. So all of this came out in the internal documents of Vioxx with go next, Nina. I think I'll have to be there. Let me just, okay. Okay, so you heard about the Vioxx affair. Now, that was one. Now, there was another trial that was done by the same company called Merck, and I don't mean to pick up one company because all companies are the same.
Just happen to have Merck.
So this was called the ENHANCE trial. The ENHANCE trial was done in people who had high cholesterol levels as a result of a genetic defect. Some of us are born with a genetic defect in which the LDL cholesterol, which is conveniently called the bad cholesterol by the drug companies, is about 2 to 3-fold higher because the liver does not remove that cholesterol because of a genetic defect. So these people are considered to be at very high risk of heart disease compared to us ordinary mortals. And so they took 800 patients in each group and they said, we're going to put you on a drug that reduces cholesterol 25 to 30% more than what the conventional cholesterol lowering drug would reduce. This was in 2006. And this trial was launched with a lot of fanfare, and what they were going to show was that it reduces the thickness of the blood vessel that supplies the brain. The thickness meaning it's reducing the plaque buildup in the blood vessel supplying the brain. Started in 2006. By 2007, there was absolutely no occurrence about giving results to the general public. They were not giving the results. And so people started asking them, hey, you've launched this trial, why are you not giving results? Ultimately, the FDA was forced to give them the data. So FDA forced them to give the data, and what we found was that the company collects the data. There are in-house statisticians that are employed by the company that organize the data. There is something called ghostwriters, people that are employed by the company that write the entire study or the manuscript, then give it to doctors like me and say, hey, if you agree with it, sign your name and put your name on it. But anyway, what happened is that there was absolutely no difference. When you looked at the amount of thickness in the blood vessel, there was absolutely no difference between the people whose cholesterol was reduced by 30% more because they were taking a Vytorin drug, which was much more powerful than Zocor. So this was hugely disappointing. And when the company started behaving like that, that is when the first time FDA put what is called the Clinical Trials Act. So if I'm a drug company, up until 2006, if I did 10 different studies on my drug to show benefit, and 9 of them showed either detriment or a lack of benefit, I didn't have to publish them at all. I could only publish the one study that showed benefit. So only in 2006 is when new clinical trial guidelines came out that said that if you do a clinical study and you register it with the you have to register it with the FDA and you have to publish the results, on at least the internet, if not in a journal. Go next, Neil. So, why did I go through so much pain to tell you this? I started out with the 4S trial, and I said this was like a blockbuster trial for the statin industry. So the reason I told you that was because that was 1994. At that time, there was no oversight by any government agency on these companies. And the 4S trial is the only trial in the clinical history of using statins that showed a 3% benefit in the reduction of death at the end of about 5 years of treatment. 4.8 years of treatment. So let's talk about it. 0.6% reduction in death per year. 0.6% reduction in death per year in the best clinical trial that was not scrutinized by the FDA. Okay? So when you're taking a statin, many people have this imaginary thing that they're going to improve by 5%, 10%, 50%, God only knows what. But the improvement in the chances of dying was 0.6% per year in the best clinical trial that was done by the statin industry. Okay? Now, I'm not talking about having heart attacks or having other issues that are easily interpretable to somebody who's gathering the data. Do you know when you do a clinical trial that has 10,000 patients, how many countries is it done in? I want to take a guess. How many countries do you think a clinical trial is done in? 5? How about 25? How many clinical centers do you think there are? 100, 150, 200? About that much, 150. So these clinical centers are in South America, in India, in Eastern Europe. Which person will have the wherewithal to supply money to employ these, to collect all the data and put all the data together for somebody to interpret? It would be the drug companies. So anyway, the benefit was 0.6%. But what came out was that this drug reduced the chance of dying by over 25%. So let's see, how did that come about? Okay, so this is what is called, how do you use statistics to deceive? So this is very wordy, so don't look at that, but look at me. So let's say your chances of winning the lotto is 1 in 15 million. Your chances of winning the lotto is 1 in 15 million. And here I am. Let's go to the next slide, Nina. And I'm a lottery expert. And I'm going to tell you, I'm going to increase your chances of winning the lotto by 50%. By 50% or 100%, let's say. So what is that? If your chances of winning your lottery is 1 in 15 million and I make it 100% better, how much would that be? 2 in 15 million. Okay? So I want $10 from you so that I can increase your chances of winning. If I show that I can increase your chances by 100%, you're more likely to give me your confidence. Go to the next slide. On the other hand, if I say this pathetic, desperate, lonely, rather hard up Dr. Ali can increase your chances by a meager, unnoticeable 0.3%, and you are not likely to believe me, right? So when you look at statin data, when you look at cholesterol data, and the reason I'm focusing so much on cholesterol is because when I tell my patients, eat fat, they put up all kinds of resistance. They think that fat is bad. When they go buy meat, they buy lean meat. Let's go next slide. So you saw what the truth was. Next slide. So what I want to tell you is that since 2005, since the Vioxx affair, the number of studies that are showing the benefit of statins in reducing death is almost close to 0%. If 2 studies show that there is benefit of reducing death with the use of statins, there are 8 studies that show that there is no benefit. There are definitely populations of patients that show no prevention or no reduction in the incidence of death, and these are women who don't have heart disease get absolutely no benefit. The number 2 people who don't benefit is women with heart disease. Women with heart disease, despite taking statins, will not reduce the risks of death. Men who don't have any evidence of heart disease, that's called primary prevention, they don't benefit. So the only group of people who might benefit, and I will grant you that, are men who have established heart disease who are in their middle ages. Let's go next. So, I have seen you guys so many times for 25 years, and I have never pursued this tactic because LDL is considered to be the bad cholesterol. Everybody says LDL is bad. But does the body really make something that is bad? Are there any benefits of the LDL? So what are the benefits of LDL? You say yes, but what are
Well, if you have an injury, doesn't it have to go toward that injury inside?
So cholesterol can increase your chances of stopping bleeding. Yeah, that's yes. But LDL is a molecule that, so in other words, cholesterol is a waxy substance. It doesn't dissolve in blood, which is aqueous, which means it's watery. So to carry cholesterol, it's carried in particles that are covered with protein. So that's called an LDL particle. So the inside of the LDL particle has cholesterol, but it just doesn't have cholesterol alone. It has CoQ10, which is important for the muscles so that the muscles can burn fuel. It's got vitamin E. It's got several antioxidants. The LDL supplies cholesterol to very important organs in the body, the brain. The brain needs cholesterol so that it can signal to other parts of the brain. The neurotransmitters, which are signaling molecules, depend on the appropriate amount of cholesterol in the brain to carry out signals. People who take cholesterol-lowering medicines can have issues with memory and cognition, can have depression. How many of you have taken this drug and your physician discussed with you that these are the possible side effects? I never used to do that. Okay, so has anybody ever told you that there are populations of patients studied in whom high levels of cholesterol is associated with better memory, better cognitive skills, better mathematics skills, lower risks of infection, lower risks of cancer, longer life expectancy? Have you ever heard any of this? Okay, so that's what I want to tell you, that there are population studies that show this. Why am I telling you this? The reason I'm telling you this is because there is this strong cholesterol diet, cholesterol drug reduction hypothesis that is telling you it reduces the chances of you having heart disease. Okay, let's go next. So the statin industry makes $29 billion a year. So there is a book written, 29 billion Reasons to Lie. And when you do a cholesterol lowering trial, the company has no interest in studying the side effects of these drugs. And sometimes the side effects of these drugs don't manifest for several years. There was a study done called the PROSPER trial in people over 70 years of age who were given pravastatin. The study was stopped in 2 years because there was a higher incidence of cancers in the group taking pravastatin. There was another study that was called Illuminate, in which the study reduced the levels of LDL to 50. Do you guys know what a normal LDL level is? What is the goal to reduce LDL with drugs? Less than 100. If you have heart disease, they say less than 70. So it reduced the LDL levels to 50. It increased the good cholesterol levels to 75. Do you know what a good cholesterol is, HDL? What is the normal level that you strive for? 50, right? So it increased it to 75. So when this trial was started, it was stopped after 1.5 years because of a higher incidence of cancer and deaths in the group in which this happened. In the group in which the HDL went up and the LDL went down. Now these studies don't even see the light of day. They are published in small journals that have no impact factor so that physicians don't even come across them. So to study these side effects, in other words, vitamin D is coming from cholesterol. When you take cholesterol lowering drugs, you reduce the amount of vitamin D. Sex hormones come from cholesterol. The backbone of sex hormones is cholesterol. The LDL supplies cholesterol to the gonads for them to convert it to sex hormones. So decreased libido and sexual dysfunction can be as a result of reduced cholesterol levels. We didn't even talk about muscle pain and other issues that are associated with cholesterol, but I just wanted to give you a flavor of this. Next slide. Okay, so far I would spend a lot of time before on this insulin resistance and other things, but today I decided my presentation is going to be very different. It's going to be about the diet heart hypothesis and about the cholesterol hypothesis leading to heart disease. So now we focus on what we should do to make you comfortable to eat fat. So this is where I come in, and I'm going to leave a lot of time for questions. What can I do to make you feel comfortable to eat fat? So out here are 3 macronutrients: proteins, fats, and carbohydrates. Which macronutrient is increasing your blood sugar the most? Carbs. Which is the next? Protein. Fats have almost no impact in increasing blood sugar levels. Next slide. So this is what I want you to eat. I want you to eat a chunk of meat, as fatty meat as possible. Put some butter to it. What is out here is egg yolk mixed with butter. Not egg white, egg yolk mixed with butter. So one of the people I admire, Andreas Einfeld, eats this. He took his blood sugar after he ate that. Let's see the next slide. What happened to his blood sugar? Flat, did not go up. Go next, Nina. Now, let's go next. So he went to a society that was serving food for him, and this food was served according to the guidelines of the food pyramid. So go to the next slide. So this is the food pyramid. It says you need to have 6 to 8 servings of what? Grains, whole grains and all that. And then after that you're supposed to eat sugary fruit. And then where are the oils? The oils are at the top, very sparingly. You should not use any fat. So when he ate this food at that conference, let's go next. What happened to his sugar? Went up to 180, and at about 6 hours, he was feeling a little hungry because his sugars went down. Let's go next. Okay, so what I want to tell you is that I want to prevent you from being scared of eating fat. I want you to eat olive oil, avocados, and butter and margarine. Because when you eat this food, when you eat fat, like I want you to cook in lard, I want you to cook in beef tallow, I want you to cook in butter. I don't want you to cook in peanut oil, cottonseed oil, canola oil. Why is that? Say that again. So first thing is correct. The vegetable oils, other than the olive oil, has a lot of omega-6. Omega-6 causes inflammation, so that's one aspect. But the second more important aspect is that these oils are polyunsaturated. When you put them in a pan, they get oxidized. They don't take heat well. What takes heat well are the saturated fat oils. So I'm standing here and telling you saturated fat is not bad for you. Now, if you look at your cell membranes, all our cells are composed of a fatty outer layer which is called the cell membrane. If saturated fat is so bad for you, what percentage of your cell membrane is saturated fat? Can you guess? More than 50%. More than 50% of your cell membrane is saturated fat. So when you eat saturated fat and you don't eat carbohydrates, which our ancestors did, the body takes this fat that you eat, or if you're not able to eat, it takes the fat from the muscle, it goes to the liver, and it converts it into small molecules which are called ketone bodies. And these ketone bodies are small molecules, much like sugar, that the brain can use, that the muscles can use as fuel. So if you want your health to improve, if you want not to get diabetes, if you don't want to get high blood pressure, if you don't want to get cancers, if you don't want to get dementia, what I want you to do is to learn to train your body how to burn fat. Let's go next. I want to tell you that we have evolved over 2.5 million years as fat burning animals. We can store about 100,000 calories of fat in our fat deposits. If we evolved as carbohydrate burning animals, we should be able to store carbohydrate. How much carbohydrate do you think we can store? 1 pound, half a pound, a quarter of a pound. Okay, a quarter of a pound of carbohydrates is all our bodies can store. Go next. Okay, now, so I get a lot of slack when I say I want you to buy butter, and if you can afford it, buy grass-fed butter. Grass-fed butter looks sort of yellowish because it's got carotene in it, it's got the omega-3 fats in it, whereas butter that is grain-fed would more or look white unless it's got bleach to color it. Okay, go next. This is a disappointment. Our use of butter has gone down over time. This is much worse. This is 1995, but it's much worse than that. Our use of shortening has gone up. Our use of vegetable oils has gone up. Why is this happening? Go next. So in 1970s to now, for the last 50 years, Procter & Gamble, which makes the vegetable oils, Crisco, crystallized cottonseed oil, has given American Heart Association at least $1 million, if not more, every year as a support for that organization. Okay, go next. So this is again showing that Crisco is sometimes hydrogenated to make it solid at room temperature so that you would use it instead of butter. Next. The eggs are the same. When eggs come from pasture-raised hen, they have a yellowish yolk because it has a lot of omega-3 in it, and it has beta-carotene and other antioxidants. Whereas eggs that are from grain-fed and caged animals have a whiter yolk. Go next. This is what I want you to eat. I want you to eat lamb. Go next. Beef. Go next. Fatty fish. So many people come and ask me, what should I eat? Should I eat fish oils? And I say, no, I don't advise any supplements. So why do you not advise any supplements? Fish oil is good for you. Most of the fish oil that we have is very high in mercury content. It's gotten from fish that live long. I would much rather you get fish oil from natural sources, omega-3, because it comes on with other benefits. Salmon and tuna are very good sources of omega-3 and fish oils. Go next. Shrimps would be very good source of fat and protein. Okay, now I get across people who say, you know, I am a vegetarian either because of ethical reasons or because of religious reasons. So I say, are you a lacto-ovo vegetarian? In other words, can you eat cheese and eggs? And if they say yes, I'd say, okay, that's good. If they say no, then I say, you're probably SOL from this diet. So I tell my patients that, hey, when you go buy cheese, I want you to buy triple cream cheese, the fattiest cheese possible. Because the fat is the one, saturated fat is the one fuel that is free of any adverse effects to the human body. And that's what you've been advised to avoid. Go next, Nina. So brie is triple cream cheese. Now, if you're really a vegetarian, then you would have to focus on eating nuts like pistachios, pecans, walnuts. You can also add flaxseed, chia seeds, and hemp seeds. So as a vegetarian, you would find it very hard to eat good fat because our bodies need saturated fat. Go next. Okay, so I'm showing some food groups. Keep going next. Okay, so for the last 2.5 years, I've seen you guys. And when I see you and I advise you this diet, many of you, to my surprise, follow it. Many of you, to my surprise, follow it. And many of you have lost weight. But that's not the only thing I'm looking for. You keep asking me the question, well, taking fat will increase my risks of heart disease. So go next, Nina. So what I have seen, this is what I have seen. This is not from studies. This is what I've seen in my patients. This is what Nina has seen. This is what Brandy has seen. Melissa has seen. Shalini has seen. We see that the quality of your LDL cholesterol, and I would not want to call it the bad cholesterol, the quality of your LDL cholesterol improves. It goes from the small and dense kind that causes heart disease to the large and fluffy kind. Go next, Nina. So triglycerides is fat in blood. Triglycerides is nothing but fat and blood. When you eat fat, you start burning fat. And when you start burning fat, the amount of fat in your bloodstream goes down. So if you want to reduce your triglycerides, better eat fat and not eat the carbohydrates. What happens to the good cholesterol? You eat 3 egg yolks a day. What happens to the HDL cholesterol? Does it go up or does it come down? You eat more saturated fat, which is the fat you've been advised not to eat. Does the HDL go up or come down? It goes up. The triglycerides come down. On the other hand, if you are eating carbohydrates, your triglycerides, so some of you come back and say, oh, Dr. Ali, it's Christmas, and then somebody was sick, something happened, and I've fallen off the cliff. And I say, Mr. Jones, you don't need to tell me that. I can see on your blood work. Okay, go next, Nina. So that's what causes inflammation, and you can reliably predict that when people have high triglycerides, low level of HDL cholesterol, and you look at markers of inflammation like CRP, it is high. CRP, C-reactive protein. Go next. So I didn't show you the many, many trials that have been done by different scientists across the world that are showing that now eating a low-carb, high-fat diet improves several biochemical markers of health. It reduces your triglycerides. It increases your good cholesterol, which is the HDL cholesterol. It improves the quality of your LDL from small, dense to large. It reduces markers of inflammation. And we can go through that in more detail at a different time. Go ahead, next. Okay, so as usual, I spent so much time talking to you all, and I want to leave a lot of time for questions, but less than 5 minutes for the next most important thing that we continually talk to you about, because you can magnify the effect. You can magnify the effect of a low carb, high fat diet by doing what we call fasting. It's the most powerful thing that you will come across, because when you are eating fat, you're burning fat. When you're not eating carbohydrates, you burn fat. So let me ask you this. When you stop eating, in other words, you've been eating fat for a week, you've not been eating carbohydrate, you stop eating. Does your body stop eating? It doesn't. So what does it eat? Does it eat protein? Does it eat lean muscle, or does it eat fat? So anybody who says takes protein as the fuel that you would burn when you stop eating, boy, you guys are so good, or non-committal. Okay, let's go to the next slide. So you've seen this slide before. This man went on a 40-day fast. For 40 days he did not eat. And his blood sugars, which started out at about 100, which is shown out here, 5 millimoles is 100, it came down to about, let's say, 75, 80, and it stayed there. Why did his blood sugar stay there? Although he was eating nothing by mouth, why did his blood sugar stay at 75, did not drop any further? Any guesses? So our bodies, amazingly enough, have a process called gluconeogenesis, in which we can convert fat molecules and protein molecules to sugar. So in other words, there is no essential carbohydrate that our body needs to eat. In other words, if you ate no carbohydrates, you would survive. There are several isolated populations that have no access to carbohydrates, like Inupiat Indians that live fine. But when you stopped eating carbohydrate, the body continued to eat. And how do I know it continued to eat? What's happening out here? That's called beta hydroxybutyrate. That's the ketone body. It went from 0 to 5 millimoles. Where is that coming from? It is coming from breaking down the fat. Okay? So let's go next. So basically showing you that if you stop eating, the fat in your fat cell gets converted to ketone bodies that can be used by the brain, the heart, and the muscles. Next. Okay. The next several slides give you just one message. And that message is that in order for you to burn fat, in order for your body to burn fat, you have to drop the levels of insulin. If you cannot drop the levels of insulin, you will not be able to burn fat. If I take a heavy person and if I take a thin person, which person has a stronger pancreas? Which person's body is making more insulin? Heavy person, right? You cannot get, I can predict that when I see somebody's weight, I can predict the amount of insulin their body is producing. Now over time, with continual ingestion of carbohydrates for 30, 40 years, what happens to your pancreas? It gives out. The pancreas dies, at which time your diabetes becomes worse. And you might also inadvertently start losing weight, because if you don't have insulin, as their diabetes gets worse, people lose weight unless they are taking exogenous insulin. So all these studies are showing is that when you start fasting, your insulin levels fall. Insulin works better. Your pancreas gets saved. Go next. So what it is showing you is that by fasting, you can decrease your insulin levels almost by 60%. Go next. Okay. You can increase your fat burning and you can reduce your fat burning by fasting. Let's go next. Okay, this is one slide I wanted to focus on. So we said that in order for you to be able to burn fat, you need to reduce your insulin levels. What is more powerful at reducing your insulin levels? A low carb, high fat diet or fasting? Fasting. Excellent. Fasting is 50% more effective at reducing your insulin levels, as this slide is showing. Go next, Nina. So the benefit of fasting happens within the first 12 hours of not eating. So previously we used to give different advice on fasting. Now we tell, don't eat without snacking for 12 hours. Either have dinner, skip breakfast and have a late lunch and have dinner or whatever, an early dinner, or have breakfast, skip lunch, have an early dinner. This is very effective. Depending on how heavy you are, you may need to do it 1 to 5 days a week. Okay? Go next. Now, what this shows, and this is an important point. People come and tell me that when I fast, my metabolism slows down. My metabolism slows down and I would not eat, then I would not lose any weight because my metabolism is slowing down. It absolutely makes no sense. So they say, if I stop eating, I'm burning protein. When I start eating, I'm putting on fat. Makes no evolutionary sense, right? Our ancestors were continually exposed to periods of feast and famine. So every time they had famine, they were burning muscle, and every time there was feast, they were putting on fat. They would be blobs of fat. But they were not. They were lean people. So this study is showing that when you fast, your resting energy expenditure is actually going up. Your oxygen consumption is going up, not going down over a 4-day period. Go next. This is showing you that when you do fasting for 22 days, alternate day, what you find is that your fat mass goes down dramatically from baseline, from 43 to 38. whereas your lean muscle mass remains from 51 to 51. So you don't lose muscle when you fast. Go next. Okay, let's go next. Okay, this is kind of a little bit of a joke slide that says that fasting can be done by anyone. Don't have time to cook, you can fast. You're too busy, don't worry. Don't have money, you can fast. Okay. All right, let's go and wrap up because I want to leave some time for questions. Let's go, Nina. Let's go. Keep going. One more. Okay. So Time magazine carried the cover back in 1970s that said fat is bad, eggs and bacon, but now they're advising actually that eat butter. So they have come around a full circle. It's only that physicians and American Heart Association and other organizations have not come around. Go next. So this is what I have seen. People in our practice come back routinely because they're able to burn fat. They improve their diabetes. They have better weight. They improve their blood pressure. And very importantly, I want to point out they're improving the quality of their cholesterol. So hence, a dietary advice of animal fat, of saturated fat, of milk, butter, lard, beef tallow, fatty meat will be associated with lower risks of hypertension, heart disease, strokes, and cancers. I never thought that 5 years ago I would be able to stand up and tell you this. Okay, but now I can. So that's all I have. Go next slide. So I put up some slides. Many people ask these questions. We can finish now and leave some time for questions. Thank you. Yes, go ahead, sir.
We grow stevia, which is a natural sweetener. Is that okay to use?
So artificial sweeteners is somewhere in here. Artificial sweeteners are not good because they cause insulin resistance.
But this is an herb. It's called stevia.
Stevia, yeah. I think it does the same.
Okay.
Whether it's artificial or natural sweetener, it will do the same. All right. Yes, sir. Go ahead.
You said that men who have artificial might benefit from that. What would the issues be of a man that might benefit from that?
So when I talk about statins, I want you to understand I'm not giving individual medical advice, but I don't believe in the data that I see about men benefiting from statins. If the benefit is there, it is very small. And there are lots of side effects that are not observed properly in these people in terms of muscular side effects, joint injuries, cognition, increased incidence of diabetes. And statins will be used for 10, 15, 20, 30, 40 years. And the long-term side effect profile of these drugs has not been studied. So personally, I try to talk my patients out of statins, telling them that I am biased. I don't like these drugs because I don't believe in them based on the information that I have read and seen. But I also want to tell them that probably 99 other cardiologists would perhaps tell you otherwise. They would look at the same data, and based on their bias, they will come to different interpretations. So I want to be humble enough, and I don't know if I sound like that, to tell you that my interpretation of the data is very different than most people. So that's the best way I can answer that question. But if you look at clinical trials alone, you would be on solid ground and say that women get no mortality benefit and people who don't have any established heart disease get no mortality benefit based on the clinical trials. Ms. Forrest, go ahead.
So you talked about skipping a meal, which is essentially intermittent fasting. If you had just fats, like coffee with butter, is that considered breaking your fast, or is that just kind of nourishment for the brain? Or?
So very good question. So what Forrest is bringing up is what is called a fat fast. So people thin like Forrest, people who exercise a lot like Forrest, who have a low amount of body fat percentage, like let's say it's less than 8%, less than 10%, sometimes they cannot fast for 12 to 24 hours without actually going into a kind of a situation in which the body doesn't feel good. So in that situation, if you want to continue fasting, or let's say you're heavy, but for whatever reason you're getting this craving for food, you can do what is called a fat fast. A fat fast is one in which you are eating pure fat. And pure fat would be like buttered coffee, like bulletproof coffee, which will have what is called high, branch chain fatty acids from coconut. There's a physician who sells, or there's a person who sells what's called brain octane, which is just basically coconut oil in which the small fatty molecules of coconut oil, which is called small branch chain coconut oil molecules, have been distilled into a packet. It's called brain octane. It's quite expensive. I don't advise that. I think you can just get coconut oil and use it too. Shalini, our nurse practitioner, comes from an area in India which uses coconut a lot. We have a standing joke that although I advise coconut oil, I cannot tolerate it myself. I hate the smell of it, so I don't use it. I like buttered coffee a lot though. So yeah, if you wanted to have a fat fast, you can do it. And that would be just as beneficial, because fat is the cleanest burning fuel that there is, unlike carbohydrates and proteins. Yes, Ms. Townsend. Ms. Townsend likes coconut oil and coffee, and she likes that. Shalini uses coconut oil in avocados. Okay, let me start asking you questions that you guys are not asking. Does having diabetes and having obesity increase the risks of cancers? And why does it do that? What is the mechanism for increasing cancer risk in there? So one of them is maybe inflammation, but what happens is that as your insulin levels go up, a substance in the body goes up which is called IGF, insulin-derived growth factor, and it makes cells multiply and it increases your cancer risk. So as you eat less carbohydrates, your IGF levels go down, so your cancer risk theoretically should go down. Yes, go ahead.
So you suggest eat no carbs whatsoever? No carbs.
Well, it's a little impractical to eat no carbs whatsoever. So I would say depending on what your body mass index is, that means how heavy you are, try to curb carbs more if you're heavier. If you're not as heavy, you can have a little bit of laxity in it. If you don't like any of the information that you heard here today in terms of eating fat, and you want to eat carbohydrates, at least eat high quality carbs. High quality carbs would be vegetable sources that are high in fiber and low in sugar. High in fiber, low in sugar. Table sugar and sweets are junk carbohydrates. Very close to junk carbohydrates would be wheat bread, whole wheat bread, rice, pasta. Any bread I would consider as junk carbohydrate.
What about beans?
So beans come somewhere between bread and the high quality carbohydrates, and it depends on what your weight is, what your insulin levels are. Some people can tolerate beans well, other people would not be able to tolerate beans well. Okay, so one other question. I had this entire talk about eating a high fat diet. Did I say anything about eating high protein? No, okay, good. Why do I not want you to eat a high protein diet? I'm sorry? Cancer risk. Okay. So when you eat a lot of protein, it increases IGF, which is insulin-derived growth factor. It also increases the release of another protein called mTOR, mammalian transfer protein of rapamycin. And high mTOR levels are also associated with cell division. A high protein diet can also be a little stressful on kidneys in people with kidney dysfunction. So you need some protein, you need moderate amount of protein, but we don't want you to go buy lean meat. We want you to buy fatty meat. Okay? We don't want you to have lean steak. We want you to have steak with fat, and if you don't find fat, put butter on it. Okay, go ahead. How many grams of protein are you supposed to have? So we say about 1 to 1.5 grams of protein per kilogram of body weight. So let's say I'm 60 kilograms. I should have about 60 to 90 grams of protein. But I don't want you to start going out there and start counting your protein calories and grams and stuff like that. Life is too complicated to make it like that. Just reduce your protein intake and focus on eating more fat and do fasting. Okay. So
when we're fasting, we should continue exercising and everything that we do normally as if we eat during the day, then, correct?
So the question is that when you are fasting, can you exercise? So in the beginning, when your body is learning how to burn fat, you would find it hard to exercise because you don't tolerate it well. But if you start exercising about 1 to 2 weeks after you train your body to burn fat, you would be surprised as to how well you can exercise without eating carbohydrates. I can do a 3-hour bike ride, do 60 miles by just eating water, drinking water and salt. Before that, I used to have about 2 or 3 gels every hour filled with sugar. And a lot of my friends do that, and there's a lot of literature that helps support the concept that you can have very good exercise tolerance on a high-fat diet, or basically on a no diet. Yes, sir, go ahead.
I've always been taught to eat 5 small meals a day. Are we still eating the five meals a day with the high fat content, or do we reduce?
So that concept of eating small meals to stave off hunger, I think, is very wrong. Because every time you eat food, because you're going to have some protein in it, and when you have protein in food, you're going to increase your insulin levels. And when your insulin levels go up, your body is not going to burn fat. So we tell our patients that fasting is good, having space between meals is good. The only change is that, let's say you do a 24-hour fast, and if you eat your entire food in one setting, let's say you do a 24-hour fast and you eat your entire food in one setting, it will be like you've had bariatric surgery. You know what bariatric surgery is? They cut the stomach size to about this small, the size of a fist. So if you're fasting, your stomach size becomes small, and if you eat a large meal, you would either feel like throwing up or you'll get palpitations and stuff like that. So in that setting, what we say is that instead of having one large meal, figure out that there's a 4-hour eating window, and in that time frame have 2 meals. Let's go ahead.
So you still should think about portion control.
So, good question. It depends. When you eat a high-fat diet, you are not creating the signals in your body that increase hunger. High-fat diet leads to satiety. But people eat food not just because they are hungry, they eat food because they are stressed. And one of the best stress-relieving foods is carbohydrates. When you eat carbohydrate, it releases dopamine in the brain. And dopamine is a pleasure hormone. It is not happiness, but pleasure is a good substitute for happiness. So figure out why you are eating. So it's always good to be cognizant of why you are eating. And what I tell is that, I've been doing this for 2.5 years. By the way, I advise nothing to you guys that I don't do myself. So many times I am tempted to eat a candy, a piece of Indian sweet, there's some weaknesses that I have. But in the last 2.5 years, maybe I have indulged in it about 3 or 4 times, okay? The reason, the way I avoid it is that I say, okay, I am really tempted to eat that. What I'm going to do is to go eat a piece of fat. So I have either buttered coffee or I have triple cream cheese. And in about 10-15 minutes, I say, if I'm still wanting that, I will have it. And 9 times out of 10, my craving has gone. By eating that fat, my craving has gone. I hope that answers your question. Mr. Goodstein, you wanted to ask?
Yeah, I was just wondering, is skipping lunch considered fasting?
Yes. I think that's what I do. I find it very hard to skip dinner. I can skip breakfast also, but yes, I think that skipping lunch or skipping Breakfast is the best. Probably skipping dinner would be the most effective, but I can't do it.
Do you have to fast? Do you have to? Is it necessary?
I'm sorry?
Do you have to fast if you don't eat?
So the question is, do you have to fast? And I think that for our health, I am convinced that fasting is a key thing, even for thin people, even for people who are metabolically completely normal, because fasting does a lot of repair mechanisms. It improves your body dramatically in many different ways. Melissa, you wanted to wrap up? You had a question, or you were?
The number one question I get asked when I explain the diet is it, it's the Atkins diet. And can you explain this to you?
That's a good question. Is this the Atkins diet? So the person who originally started this diet, you'd be surprised to see, was William Banting. William Banting in 1860 started it, 1860. So it's called the Banting diet and then Atkins diet. We owe a lot of tribute to Dr. Robert Atkins for pushing this. And at the time Dr. Atkins was pushing this, he didn't have the data. He didn't have the science behind it. And he was an isolated, lonely figure, and he was ridiculed by the medical community. So even now I stand here in front of you and I can tell you that when you go back to your primary physicians, they're going to ridicule me, saying that this is bad. And that's okay. I can take that. But Atkins diet is a little fundamentally different because it doesn't differentiate between protein and fat. So we don't want you to go out there and start eating lean protein. We want you to focus on eating fat. So I would say that is the major difference. And now we have scientific studies that show that this helps. Let's take one or two questions more, and then me and all my people will stand here. You guys go ahead. You have.
How do you feel about lunch meat?
Okay, very good question. So nitrates and nitrate-free meat. So basically, nitrates in some processed meat is supposedly associated with cancer risk.
Yes.
And so people are advised not to eat processed lunch meats and things like that. So I'm not sure, because I'm not sure that based on the population studies that were done, whether their cancer risk was high because of other risk factors like smoking and eating carbohydrates. People who eat lunch meat or processed meat also tend to eat a lot of refined carbohydrates. So what contributed to it? Was it the lunch meat or was it something else? And I'm not sure about that. So I would say try to eat nitrate-free meat, try to cook your own meat. But if you ask me, is lunch meat better than eating a sandwich with bread? Absolutely. Eating the lunch meat alone and throwing the bread off is something that I routinely do if I don't find food. Please go ahead.
So
I'll come to you.
I want to make sure I understood. 12 hours without eating is a fast.
Yes, even 10 hours without eating could be considered a fast.
And if I have the choice between pork ribs or a lean piece of chicken, I need to go for the pork ribs.
Absolutely, sir. Don't eat the white part of the chicken. If you eat chicken, eat it with the skin and eat the dark part of the chicken. Yes, go ahead. I'm sorry, I missed you.
Your body in the ketosis.
Mm-hmm.
So as a diabetic, how do you balance to stay in the ketosis where you're burning fat and not overdo it and go into ketoacidosis?
That's a very good question. So the question is that there is a condition called ketoacidosis. So it depends on your stage of diabetes.
I was diagnosed a year ago, 6.7. H1C is down to 6.3 now. I take 1,000 milligrams of metformin, 500 in the morning, 500 at night.
So that's the only drug you take.
That's it.
So in all likelihood, what I would say is that you are a type 2 diabetic who's still making plenty of insulin. And when you stop eating carbohydrates, your body will continue to make insulin to prevent you from going into ketoacidosis. So in other words, you will have basal insulin release all the time. People who can go into ketoacidosis are people whose pancreas cannot make insulin.
So their A1C is, we're talking 11.
Not necessarily. You can have an H1C of 6.3, and when I check your pancreas for insulin and I check your insulin resistance and insulin sensitivity, you may be in a stage in which your pancreas is burnt out. So the doctor should be pretty smart about checking your insulin levels and seeing where they are. And it is very unlikely that an early type 2 diabetic who is just maintaining a hemoglobin A1C in the 6 on metformin alone is in a stage of diabetes in which the pancreas is burnt out. That is not really the case. I don't know if that answers your question, but yes.
Yes, definitely.
Okay, Mr. Goodstein, sorry.
I have a question. I've always been told that buffalo meat is better for you than regular beef.
Is it fatty buffalo meat or?
No, they said because buffalo meat is leaner and higher in protein. Now what you're saying is skip the buffalo and go back to beef.
I don't want you to focus on lean meat and lean protein. I want you to eat the fatty part of the animal, because that's a big difference in what the advice has been. So I'll get to you in 1 second. You had a question. Go ahead.
All right, you said eat the skin, you know, like for instance on chicken. But some people get really, and you turn that around and they're like, aha, you hear this? I can have some fried chicken. But you know, that would be breaded. That breading would not be good for you, right?
So fried chicken which is breaded would be horrible. And usually most of the fried chicken that is breaded would be fried in peanut oil or some kind of a vegetable oil, and it would be bad. And frying foods, I'm not sure is that good. If you really want to fry food, you should fry it in saturated fat, lard and beef tallow and butter. You know, that's what I would say. You had a question, sir?
What about barbecue?
Barbecue is coated with sugar, right? The sauce has sugar, right?
Don't use the salt.
Don't use the sauce. But then will you really enjoy the barbecue? I'm not sure. All right, hey, you guys, I didn't give you individual advice regarding cholesterol. That was the first time I went so anti-cholesterol and anti-cholesterol medicines in front of a larger audience. So before you make any changes, consult your doctor. And thank you. We'll still stay here, and if you guys have any questions, we would be still individually able to answer it. Thank you. We pulled it off, did we? So this one was very different than how I do it, right, Nina?
I really like these ones, the different ones. Yeah, to me they're a lot more interesting.
Miss Lorma.
Said she's going to try next week, but she's been working till 9 o'clock for about 3 nights in a row.
Forrest, I hope it was worth your time, Chief.
Really, it was. I'll be talking more about it. It's very revolutionary.
Thank you, thank you.
Everything we learned in medical school, so it's really.
It's different, right?
Yeah, I think a lot to think about actually.
It's different.
Yeah. Did you ever take a look at my blood work?
I didn't. I should look at it. I'm sorry.
She said it's like a rock star, so you don't even have to
Oh, good. I'll take a look.
Okay.
Thank you. Thank you for your support. You were a source of inspiration, because whenever I was seeing you, I was saying, I'm doing something right.
Thank you.
You were very nice.
I'm Deanna's mother. But I want to ask you a question. I'm on warfarin because I had a AFib problem. So is that something that you have to,
You don't have to change that for this.
I didn't think so.
But if you eat a lot of fruits and vegetables, you may have to monitor your INR levels more. And you should consider talking to your physician and going to the newer drugs that don't require changing your diet.
Yeah.
In other words, you can eat all the fruits and vegetables and you don't have to change the warfarin. I mean, you don't have to change the dose.
Yeah, so it's just a matter of going back
Right.
to changing the higher dose.
You should. Different drug.
Different drug.
Yeah, there are newer drugs called Xarelto, Eliquis, Pradaxa. You can take those and then you won't have to monitor your INR and you don't have to change your diet.
Thank you so much.
Dr. Ellie.
Did you learn something? Your diabetes will be so much better.
Yeah.
Hey!
This is my granddaughter, Caitlin.
Caitlin, how are you?
I'm David Ives. I don't know if you remember my name or not, but
Yeah, Mr. Ives.
Yeah.
Right, David.
yeah. And I wanted to ask you about a study that was done, and I found it on the Netflix, and it's called Quarks Overnight.
Right. Yeah, that's Dr. Cadwell Esselstyn. He did the China study.
Yeah.
And he advises.
1 billion people.
Yeah, well.
That's a lot.
So what he advises is not to eat any animal fat and animal protein. He advises exactly the opposite of what I advise. And he says to eat whole wheat bread and vegetables and grains.
No.
He does.
Does he?
Yes.
Well, I didn't
I have
get
looked
that.
at the
He
Cadwell
said he ate a
Esselstyn.
whole
Folks.
food diet.
Well, yes. He at least to his credit, he says don't eat sugar and sweets and eat complex carbohydrates. But I disagree with that. I think that Dr. Esselstyn is taking a group of people from China who are very different than us. They toil in the sun, they work hard, they are not sedentary, they are not industrialized, so their level of physical activity is a lot more. So they can tolerate the carbohydrates better than us. So I don't agree with Dr. Esselstyn, but yeah, I have seen it myself and have read it myself.
Well, the rate of cancer stuff was really outstanding.
It will go down.